There's music playing in this labor room, a birth companion to comfort the pregnant woman.
किस लिए बिठाया आपको मालूम है? हिम्मत देने के लिए।
Curtains to ensure her privacy. A government hospital with a difference that is implementing respectful maternity care. Most public and private hospitals in the country, including some of the best known ones, present a stark contrast. Listen in on the experiences of mothers who recently had their deliveries at government hospitals.
हाँ जी, यहाँ से दूर है डिस्ट्रिक्ट में।
सरकारी में सब कुछ फ्री हो जाता है तो हम लोग तभी जाते हैं कि हम सरकारी में जाएंगे। डॉक्टर से वो ऐसे बिहेव करते हैं बट उनकी जो लैंग्वेज वो इतनी वर्गर होती है। हाँ जी बताइए क्या करने आए हो, प्यार से बोलेंगे तभी हम बोलेंगे कि हाँ भी हमें ये प्रॉब्लम है। उसका नाम नहीं याद, गायनी का, उसने बहुत बैडली ट्रीट किया था एंड शी वाज सेइंग क्या इतना मोटा शरीर है, ऊपर से खांसी है, ऊपर से थायराइड है, ऊपर से ब्लड नहीं है, 9 ग्राम ब्लड है, मैं तो नहीं तुम्हारी डिलीवरी करूँगी, यहाँ से जाओ। तो प्राइवेट में को इसलिए अच्छा लगता है क्योंकि वो हम जब भी जाओ ना वो ऐसे हमें गाइड करते हैं जैसे पता नहीं क्या चीज़ है।
मेरा हस्बैंड प्राइवेट है, वो नहीं करवा सकता है प्राइवेट भी, फिर उन्होंने सानू रजिंद्रा च भेज दिया सीगा भी उत्थे करवाओ जाके।
काफ़ी दूर
काफ़ी टाइम लग गया सीगा,
टाइम
पौने 2 घंटे लग गए सीगे। मैं पूरी दर्द सीगी, मेरी इन्नी हालत खराब सीगी। उन्होंने कहते सीगे पानी, मैं अपने हस्बैंड ਨੂੰ ਕਹਿੰਦੀ ਸੀਗੀ ਮੈਨੂੰ ਇੰਨਾ ਪਾਣੀ ਦੇ ਦਿਓ, ਇੰਨਾ ਪਾਣੀ ਦੇ ਦਿਓ। ਮੈਨੂੰ ਪਤਾ ਹੈ ਸਵੇਰ ਦੇ 4 ਵਜੇ ਤੋਂ ਲੈ ਕੇ ਤੁਸੀਂ ਦੇਖੋ 2 ਵੱਜ ਗਏ।
ਫਿਰ ਐਂਬੂਲੈਂਸ ਵਾਲੇ ਕਰਦੇ ਨੇ ਵੀ ਤੁਹਾਨੂੰ ਕਿਲੋਮੀਟਰਾਂ ਦੇ ਹਿਸਾਬ ਨਾਲ ਪੈਸਾ ਲੱਗਣਾ ਆ, ਇੱਥੇ ਨੂੰ ਲੈ ਜਾਓ ਤੁਸੀਂ, ਫਿਰ ਉੱਥੇ ਜਾ ਕੇ ਰੌਲਾ ਪਾ ਲੈਂਦੇ ਸਾਨੂੰ ਇੰਨੇ ਨਹੀਂ ਇੰਨੇ ਪੈਸੇ ਦਿਓ, ਅਸੀਂ ਵੀ ਤਾਂ ਦਿਹਾੜੀ ਲੈਣੀ ਆ।
तो प्रॉब्लम ऐसी टॉयलेट थी जो कोई सफाई भी बिल्कुल नहीं थी, जहाँ पर मतलब पानी भी ऐसे रहता था। मैं तो कोई जाती सी लेडी उसकी ब्लीडिंग भी ऐसी पड़ी है, उसको ऐसे रहता भी उछाली आती हैं सीधे।
वेटिंग हुई है ना, नर्स बोल रही अभी नहीं देंगे। मैंने कहा क्यों क्या बात है, कह रही पैसे लेकर आओ। मैंने 200 रुपया लिया और दिया, कहती नहीं 500 रुपया लिया, फिर वो बच्ची को दिया। तो असी डॉक्टर कहते जल्दी से जल्दी इसको शीशों में रखना है, बच्ची को कमज़ोर है, मशीन में डालना है।
हमने सरकारी हॉस्पिटल, डॉक्टर तो छुट्टी में थे, हम गए रात को, तो जब मुझे दर्द हुआ तो वो कहते वो ले जाओ भी, यहाँ पे नहीं, डॉक्टर छुट्टी पे हैं। तो फिर उन्होंने कहा, फिर हम वहाँ पे गए, उन्होंने कहा भी पानी की थाली भी फट चुकी है और नाड़ू बच्चे का विचकार में है। फिर उन्होंने हमें रेफ़र कर दिया 32 में। हम 32 में गए, फिर 32 में इसकी डिलीवरी हुई।
वहाँ पे कुछ ऐसा था कि जैसे 300-400 के करीब पेशेंट्स होते थे, तो एक ही डॉक्टर बैठा है। बीपी के लिए आपको मतलब लाइन लंबी इतनी इस कंडीशन में इतनी बुरी हालत हो जाती है कि खड़े रहो। मतलब जब इतने ज़्यादा पेशेंट्स आपको पता है कि गवर्नमेंट में आते हैं, ठीक है, सभी आते हैं, छोटे बड़े लोग सब आते हैं, ठीक है, एक ही बीपी ऑपरेटर से आप सबको चेक कर रहे हो, ठीक है, कोई बाहर इतना हरास हो रहा है, इतने खड़े हैं, तो मतलब वो अपनी बातें गपशप में लगे हैं, चाय पी रहे हैं, इतनी रूडली बिहेव कर रहे हैं, वो मेरे को बिल्कुल अच्छा नहीं लगा।
These voices find resonance with women in different geographic locations in the country. Women define respectful care as an indicator of quality of care. They talk of availability and access, of cleanliness and hygiene. Take, for instance, denial of care caused by lack of infrastructure like beds. This room has 2 mothers and 2 babies on each bed.
प्रॉब्लम तो है मैम, देखो जैसे मैं लेटना चाह रही हूँ, मुझे लेटने की स्पेस नहीं मिल रही है बिकॉज उनका भी बेबी है, उन्होंने भी करना है, इसलिए प्रॉब्लम है। इवन कि पीछे मैं अगर बैग अपनी लगाना चाह रही हूँ वो भी नहीं लगा पा रही प्रॉपर, तो अनकम्फर्टेबल तो दोनों ही हो रहे हैं।
Experts say negative experiences contribute to fear and distrust of health facilities, leading to underutilization of healthcare services. While the number of women who deliver at government hospitals has registered an increase in the last 10 years, there has not been a proportionate decline in maternal and newborn deaths. The maternal mortality rate has reduced to 167 for every 1 lakh live births, but it is still over twice the target of 70 set to be achieved under the Sustainable Development Goals. Sustained efforts are necessary to bridge the gap.
चुपचाप थी, ठीक ही थी। वही है कि जो चुपचाप रहेगा उन्हीं को संभालते हैं वो।
आप चुपचाप थे?
मैं तो चुपचाप ही थी।
जो चुपचाप नहीं होते?
बस उनको तो वो डांटते हैं फिर।
Ensuring respect and dignity is becoming a critical indicator of quality in maternal health care. But few healthcare providers are sensitized about its importance. It could impact the pregnant woman's decision to return to the public facilities. Many cannot afford the exorbitant costs in the private facilities and opt for home delivery. A majority of healthcare providers, including doctors, view respectful maternity care as an esoteric concept. There are very few studies conducted on the subject. There are very few platforms for women to express their voices about their experience during pregnancy. In the meantime, we see normalization of disrespect and abuse in maternity care across private and public health systems. Women face subtle discrimination, even overt violence like being slapped and abused during labor. Many doctors and nurses continue the controversial and wrong technique of fundal pressure or manual pressure to the uppermost part of the uterus to practically force the baby out. Here, the staff have climbed the labor table to push on the abdomen. It could lead to perineal lacerations and urinary problems. Independent studies in Punjab, Orissa and Assam released this month have found that mistreatment during childbirth across facilities is widely prevalent.
एक इच्छा थी कि देखें कि ये डिसरिस्पेक्ट हो क्यों रही है, कैसे हो रही है, किन वजहों से हो रही है और जो वजह है क्या हम उनको ख़त्म कर सकते हैं। और क्योंकि एक ऑब्जर्वेशन ये भी है कि ये डिसरिस्पेक्ट ज़्यादा एशियन या इंडियन सेटिंग में ही क्यों है ना, ये बाकी जगह पे क्यों नहीं है, उन्होंने कैसे अपने आप को बदला होगा और हम क्यों नहीं बदल सकते।
The studies have identified 7 categories of disrespect and abuse that violate the universal rights of childbearing women. They include abandonment or denial of care, non-dignified care, non-consented care, non-confidential care, physical abuse, detention or demand for payment, discrimination.
There is still some sort of discriminatory behavior, discriminatory attitude towards people who come from poor backgrounds or who are uneducated or who don't immediately understand what is being said to them. There is still a problem of leaving the patient in the delivery room by herself. There is still a problem of not allowing birth companions inside. There is still a problem of rough physical handling.
According to the White Ribbon Alliance, a network of maternal health advocates, there should be zero tolerance for disrespect and abuse in any kind of facility.
In order to make respectful care standardized, we need to work at multiple levels. I think the first thing that we need to do is we need to talk to providers. We need to understand how do we create an enabling environment where the providers can actually provide respectful care. I think we should not undermine this necessity. I think the second thing is we need to focus more on paying enough attention to the needs of the women. And I think the third and very important thing is how do we really include women, their families and the communities in trying to ensure that service uptake is better, service availability is better.
The government says it is ensuring improvements in the experience of childbirth in labour rooms and operation theatres across the country. The objective is to provide respectful maternity care.
The government has recently launched Lakshya program, which is basically focused on immediate intrapartum care as well as immediate postpartum care. So here what we have done is that this Lancet paper had come earlier, which showed that if you give quality of care at birth, you can reduce 46% maternal mortality and 40% neonatal mortality, including stillbirth. And already 7 states we have done state orientation, and 250 facilities have been projected to where this program will be rolled out. We are taking, you know, medical colleges, district hospital and FRU or first referral unit in the first stage. We have a checklist which will be run, and then we have our parameters on which the you know, facility will be basically evaluated. We have already allowed birth companion to the woman in labor room. We have also shared standardization of you know, labor room designs, which we have shared with the states.
Coming up after the break, a unique hospital committed to respectful maternity care. At PGI Chandigarh, a tertiary care centre, lack of infrastructure and human resources have been identified as major challenges in ensuring all dimensions of respectful maternity care. For instance, birth companions, privacy and a bed for each woman in the postnatal ward.
We need more number of doctors and more number of sisters and more facilities, that also, and more space, of course. This labor room was built when PGI was built in 63-64, and since then the population of Chandigarh has increased manifold and the patient load has increased manifold, but the space is the same. Now, though we are trying, government has already sanctioned us new mother and newborn center. Today only we got that approval, you know.
Meanwhile, the 60-year-old Government Medical College and Hospital in Aurangabad, Maharashtra is leading by example. Respectful maternity care here starts with the outpatient department for pregnant mothers. There are no queues, no chaos.
उधर जाकर भोजन करने का.
It helps that the staff is courteous and the workflow well organized.
छोटे उम्र के डॉक्टर हो गए तो मेरे को वो बेटा करके कॉल कर रहे थे, तो वो मुझे बहुत अच्छा लगा. और जो वर्कर्स है कि ये सिटिंग टेबल्स पे जो सब बैठे हुए हैं वो बहुत अच्छी तरह से बात करके मुझे बता रहे थे, अब आप भी आ जाओ, 1 घंटे बाद आपको आना है. ये सब अच्छी तरह से बात कर रहे थे, तो वो भी मुझे अच्छा लगा.
Soft music plays on as curtains shield pregnant women from the sun. Compare this with another outpatient department in the same hospital.
Birth companion register is there, so their name is enrolled.
For those who can read, there's a lot of relevant information in different languages.
We think that as a healthcare provider, if I am treating her, if I am giving medicines to her, if I am examining her, that is the respect. But actually this is not respect. Respect means how you are welcoming her. When she is waiting for your examination, what conditions you are providing there. Whether you are addressing all issues properly, and identification of 7 rights of the woman in a birthing is not known to many things.
There are separate cubicles for examining pregnant women. Patients are provided chairs. Senior doctors counsel them, maintaining eye contact. It leads to a more meaningful interaction and better responsiveness to treatment.
हमें तो गवर्नमेंट हॉस्पिटल पे भरोसा नहीं था, लेकिन जिस प्रकार की ट्रीटमेंट यहाँ पे मिली है तो बहुत ही हम सेटिस्फाइड हैं इसके बारे में.
The guidelines for 8 antenatal checkups instead of the earlier 4 checkups are being followed.
डॉक्टर एकदम अच्छे बताते थे, सब जो कुछ प्रॉब्लम है वो सब समझा के बोलते थे. फिर उसके बाद में नर्स भी समझा के बोलते थे. उधर सब पॉश एकदम सब कुछ, कोई प्रॉब्लम नहीं था, समझा के बोलते थे. जो अपना टाइमिंग पे ये अपना सोनोग्राफी करते थे, सब कुछ सब टाइमिंग पे करते थे वो.
In the labor room, curtains separate the beds.
किती वय आहे तुझं? तुम्ही सांगा. तुम्ही आई आहे का तिची?
Doctors inquire about Priyanka Chandan Shiv. An agricultural labor, she travelled 160 kilometers for her delivery here after she suffered convulsions. Every woman has the right to information, to informed consent and refusal. For example, this consent form is for starting treatment of women with low amniotic fluid. When procedures are explained and consent is given, it increases participation of women in managing complications.
भरपूर सुविधा झाली, लक्ष देता पहिल्यापेक्षा. साफसफाई, लक्ष देणं, सगळं.
We have a high dependency unit, we have a obstetric ICU, then we have all the latest technologies, then we have all the latest updates, the protocols,
the postgraduate students are there. So I think this makes a lot of difference, and above all, I have a very dedicated team here.
Respectful maternity care is giving the woman the right to choose a birthing position. These positions are more upright and use gravity to push the baby down. This hospital has stopped giving fundal pressure to women. The tertiary care centre sees between 50 to 60 deliveries every day. Last year, over 17,500 deliveries were conducted.
The companion was there, she was supporting her during her pains. So the woman is offered companion also here. आप इनो रहे तो अच्छा लग रहा है क्या, इनको बाहर बिठाना है, कैसा है? अच्छा लग रहा है. So she is happy because somebody is sitting with her. In the same way again, the woman is in labor and she is having her companion. तुम्ही कोण आहे यांचे? आइए, she is a mother. Here also we have given that birth companion, this labor positions, birthing positions.
Just 1 year ago, the Government Medical College in Aurangabad, Maharashtra did not allow a birth companion. Today, it is the norm. A birth companion is trained by the doctor to look out for danger signs in the expectant mother.
Hospitals are reluctant to allow birth companions in the labour ward, saying it leads to overcrowding. Birth companions, however, help patients who feel abandoned when nurses are busy.
It gives a psychological support for the patient, so it is important. So I think that birth companion should be there. This change what Sir has done is good.
The nurses make the mothers start breastfeeding within an hour after delivery. Like many other guidelines, this was not being implemented earlier. For the nurses in charge, who have worked for 36 years in the hospital, it meant getting used to a lot of changes.
अच्छा लगा शुरू में बोले थोड़ा सा नया चालू करे तो थोड़ा सा ये रहता है ना अपने को कि ऐसे कैसा थोड़ा ये होता ये करने के डिफिकल्ट लगता शुरू में, लेकिन अभी ठीक है। फेवर में है, लेकिन उनके लिए हैंड्स ज़्यादा होना चाहिए। हैंड्स होना चाहिए, फेवर में है लेकिन हैंड्स होना।
While staff shortage poses a real challenge, the team says the key to improving quality of care is a change in the attitude of healthcare providers.
What are the danger signs during labor? It can be headache.
In the classrooms, a new generation of doctors is being sensitized about respectful maternity care or RMC.
Because in curriculum we don't find RMC. But now it is a need that women should get respectful maternity care. I always say that not only about mothers, it is true for any patient.
The team's initiative has challenged the perception that if the facility has a high caseload, if there is a shortage of human resources, there is no time to treat anyone with respect. Respectful maternity care is central to providing good quality care in order to bring down the high prevalence of maternal mortality and morbidity in the country. For every maternal death, 20 to 30 women live with serious pregnancy-related health complications.
When the public health system provides respectful maternity care, it prevents over-medicalization of labor. It prevents caesarean births.
It encourages women to seek care.
More importantly, it gives the mother a positive pregnancy experience.